This digital open door generates what? Before, amongst other things, confidence, empathy, confidence. And when the person thinks about health, when the member of health thinks about health, they think about the health team and the decisions the member is going to take that are complex. They make they don't make them alone. The team helps and coordinates the person to make decisions. So the consequence of that is that 98% of the events that happen in secondary and tertiary care have been coordinated and forwarded by the primary care. It's very crazy. Only 2% of people say, no, headache, I'm going to a neurologist, ER. They sort of trigger the health team. They can call them physically. So we have sort of outpatient clinic that we call Alice houses, and then they're going to be referred to secondary, tertiary, if the protocol considers pertinent to go directly to ER, they will. What is incredible is 98% of events people count on a health team and they do what the health team is supporting them in a coordinated way. This reduces a lot waste, but more than anything, it increases pertinence. More than anything, it's a greater demonstration that the person trusts Alice and the health team, the person's health team. To me, this indicator is incredible. This means that we have the person in the center of the whole experience. So it's our NPS is close to 90 and our SAT from 0 to 5. So for all events, when the person is cared, is 4.93. So it's all about experience, the journey of the person that matters most. Once the person trusts Alice, the care, the pertinence of what's going to happen is very much related and much more appropriate for the person and for her health system as a whole. And sort of adding to that, I'm going to add to what Goza said. And so you're creating a concept of loved brand. I've always told doctors there is no loved brand in health. Nobody wakes up in the morning and say, I love A and B. No, nobody says that. We are creating a concept of a loved brand, a concept of community. So we're moving out of the box of being just the digital health operator and opening this community to specific acquisition, one-stop shop for those that cannot buy a healthcare insurance, but actually being able to access your digital ER, etc., for specific things. Considering that the consumer wants to have convenience. And it is surreal when the pre-pandemic period we subjected, we forced people to displace themselves to literally for low complexity urgencies, both in the public and private sectors. I woke up with a sore throat, I had to get the car, go to the ER, wait, the public system, take a bus, subway, miss a working day, 3 hours waiting in the line. This is the reality. Today you can do everything in this device, regardless of where you are. So the patient has learned to become healthcare consumer during the pandemic and learned conveniences and comforts. They liked it with comfort. So conveniences that we have with iFood, etc. So Vitat started realizing that, considering wellness, well-being, and obviously this scope, the portfolio is going to grow, and you already have huge retail experience, and you're going to start with service retail. I'd like you to tell us about this part of service retail and retail, what you're doing in health, how you can use this experience of the pharmacy of the future that no longer sells boxes, but services and to promote health in cases that are phenomenal of engagement. And that's where consumer goes. In the pharmacy, they're used to being in the pharmacy. So it's an engagement point that is very important that I'd like you to tell me. So I'd like you to score this goal so that we can move on to Salgado. Thank you for bringing up this ball for me to sort of kick it towards the goal. So you know several things you talked about Vitat, but I'm happy to see that the concept is so clearly put. Actually, I think that connecting to what Guy said, this movement of customer or focus is part of the Vitat within this action. When we started thinking about RD was a company, so I've been here for 10 years. It's been a very successful company in pharmaceutical retail and lived a cycle of prosperity growth very strong since the merger in 2011 until today. Until 2016-17, it was very much retail, and retail very physical with digitization at a stage that was more initial. We're not from a retail segment that was so quickly impacted by digitization, but between 16 and 2017. So we see the digital transformation moving fast. So there was a change in the mindset, digital transformation. That was important to have the customer oriented practice. So this was part of the digital transformation that was moved beyond. So from the time you really understand the client and their needs, I have to see how the business can evolve. It's not digitizing the business and say, okay, we have to be better at retail, introducing digital channel connected to physical one. It was not just that. Could be, but it wasn't that only that. What we concluded over the years between 2016 to 17 is that our role as a company should change and evolve. And that's everything. Since we are a pharmacy network, first point of our thinking came from the pharmacy. What is the role of this pharmacy? So if it has to be transformed, what is this role? So then you ask the client. When you go deeper into this understanding, you get to the point you were talking about. The pharmacy is a meeting point for people. The pharmacy, we have 2,400 stores in Brazil, so we have a physical contact with the clients that is very good. We have that team of caretakers in the pharmacy, pharmacists, clerks, and they're there, or shop assistants. So people go twice a month to the pharmacy. So we see the clients when they go and buy a product from us, they're not looking for the product. They have a problem, something related to health, and they're going to get part of the solution to their problem there. They're going to buy a drug for diabetes. I'm not just in need of the drug. I need in this journey, I need a nutritionist. I may need a personal trainer. I may require other healthy food items that perhaps are not sold by the pharmacy. The journey of the client that goes to our pharmacy is much broader. And that pharmacy, we understood, we're still restricted. We participate little in this journey of caring for the patient. And following that, with this insight, we realized that if the pharmacy cannot provide that it's not its role to provide that. We're not connecting the pharmacy to all the rest, because the entrance door, we have it. We are this entrance door. We have the relationship. We have the human contact. So what can we do? We can add more to this pharmacy, bringing more services in. We can diversify more our mix, bringing more of the concept of healthy living there, or wellness. And we, more than anything, we can connect it to other peers, to other service and product providers to be part of the client's journey. So this is what they are seeking. That's how Vitat was born. It was created as a platform that is going to connect this world of 2,400 stores for 40 million clients connecting to the stores, and we go beyond. And we're going to connect through a marketplace of products, very specialized focus in health. So we want to bring an assortment much broader of healthcare products focusing on prevention, and marketplace of service, health service. So we want to complement connecting the pharmacists with doctors, nutritionists, personal trainers, psychologists, with labs, with gyms, fitness centers, with other agents in the health system that can articulate and act with us in network to provide more complete health solutions to our clients. So Vitat's vision was born from this vision and the understanding that we had to go beyond because there is no longer a linear business model that I'm a pharmacy, they are a hospital, they are a lab. No, we have to articulate ourselves. We have to connect to bring more complete solutions. To wrap up this focus of prevention and health. That is our focus, our role to promote health because we are close. And for that, we have to work very much this concept that we've been talking previously to make health become something nice. Health is, well, being healthy is eating salad, to sleep early, and I want to go dancing. And so you have to start and sharing with people the vision that being healthy is nice. And the pandemic has shown that the interest of people have increasingly more to be healthy and updated with their own issues, to live well, to have good quality of life. Hence the need for us to encompass all of that within a brand that brings this concept of life that is good and that is aspirational, that is life, that is loved, to build a brand that inspires. Health is cool. It's not a disease. Health is the lifestyle, and this is what Vitat is proposing to bring.
That was awesome. And now I'll give the floor to Salgado. You represent a corporate health company, one of the biggest groups of corporate health in Brazil. And that's what you do. Some people say they do that, and actually you do it. I think the biggest difference is that, well, data doesn't mean anything. Data is important when you can do something with them. If you're in a company, for instance, and there are 30 people who are diabetic in that company. So, okay, what do you do with that? And if we apply that to corporate health, and here I'm making a bridge with Bruno, if you get connected to a Vitachi, you'll gain in penetration because that individual that works 8 hours a day, and if they've taken a leave or if they have to take a leave for a matter of primary care, they'll leave the company, and at least maybe twice a month, they'll go to a pharmacy, maybe not to buy medicine, but to purchase toothpaste or a hairbrush. So when I see this corporate health going beyond the borders of a company and able to engage patients in other points, then we start seeing a new healthcare models. So I'd like for you to compile all that, what happens inside companies and how 3778 is being able to expand that beyond the borders of companies. And I know that you do that. You're on mute. Yes, like Pipponzi said, we don't really use what other players from the ecosystem can give in terms of benefits to people. And I think that corporate health needs to be transformed and not digitalized. And that's where it starts, because the periodic health exam was created to be a touch point for people's health and to understand how people's lives are evolving before they become ill or after they become ill. And what he said is that the fact that you have a health condition does not mean that you should not promote and prevent disease. Like what Pipponzi said, well, I'm super healthy. I don't have any disease. I'm on Instagram and LinkedIn, and I'm truly an example. So there's nothing for me in there. But the fact is, there is something for you. So understanding that to engage people when we look at the periodic health exam and what we can generate from there, you start getting to know people before they need to consume. And that's very, very relevant, and the population as a whole. So the first thing that we work with is to make sense of something that does not make sense. to transform that into something that you really see value in. It really changes. If you ask people who would like to do a periodic test, no one will volunteer, or who would like to do a checkup, everybody will like to volunteer. No one will get the results of the exam, but they want to do it. They want to take the test. So first, okay, if there's nobody to monitor me, we know that if there's any problem, I'll be there. There are some cases where 70% of people that do a checkup will not come back to get the exam results. And again, that relates back to fragmentation, and hence the data that you talked about, the importance of understanding people and understanding the journey as a whole, and where other players come in. You talked about having to travel. There are certain portfolios where the main point of non-adherence to the pregnancy program is related to transportation and commuting. Sometimes having to take a 2-hour trip, you're pregnant and you're feeling sick, and you simply don't go, right? So understanding that and bringing that with all of the touch points we now have within the company to take that outwards is something that we're doing. So the transplants make sense. That makes sense for us. Every touch point, absenteeism or leaves, transactional data, all of our projects, we've been working on how to transform transactional data into data that we're able to understand the possible journeys that happened, to propose different journeys. And along those lines, we have some pilots going on based on the simplest data we have. We propose full journeys that include medicines that that person is going to need when they need it, because that's another point of adhesion to treatment. It's all about access, cost, and making access easier. We firmly believe that being cost effective promotes access. So, especially in the context we're in. And to mention another experience, it was a specific company, and everybody in Brazil has a smartphone. In theory, everybody would have access to digital health, but in practice, people didn't have data, or the way they used their smartphones made it almost impossible for them to adhere to a digital journey the way they're set up today. So what does that mean? The project that we're making, is it really making a difference in people's journeys? There is a large number of people that we don't have data for. So how can we solve that? And again, there's this fundamental role of companies. When you look at the journey as a whole, it sometimes makes sense for you to fund that data so that you have the necessary information and for it to be there when you need it. That is an extremely important incentive when it comes to funding. And also moving away from the one-size-fits-all recipe and becoming effective at being able to do what we have to do. I'm talking about the system as a whole. I still believe that we are still on a journey of digitalizing. We're still replicating things that we did in the physical reality and bringing that to the digital world with little articulation, with little connection. And that's what we are proposing. It has to be coordinated. It has to be integrated. And what we do is to bring yet another piece of this puzzle and this context of people that work for 6-8 hours a day for them to become another agent for this engagement. You mentioned a very interesting aspect. You have to know your customer and their pain points. There are many startups that simply want to impose their products in the market. But, well, it's very clear. Why don't pregnant women go to the appointment? Because it takes too long for them to get there. And in terms of health, I come from public health. And the business model, I did it when I was a director of a public hospital in Santa Catarina, where I was the health secretary. So I would create the rules and I would sign them. And, well, when you have this power, you can do it. But it was a small city where trips were easy. And when that model was taken to São Paulo, the biggest cause of a no-show for patients in the public health system line, they're able to make an appointment at a private hospital and they wouldn't show up. Why? Because they were supposed to be there at 10 p.m. and there was no transportation. So that's what it means for you to really look at your customers. How can you solve that? Well, by making a partnership with Uber. If you don't look at the journey and if you don't try to solve it, you end up creating a product that you may think has no penetration in the market, but that's really because you're not identifying the pain. When you talked about checkups, well, checkups are the most boring things in the world. No one wakes up in the morning and willing to do a checkup. I'm a woman. They'll simply grab my tits and stick things into me. I'm not a masochist, right? So you have to transform a checkup into an event. To go with my university friends somewhere, and we go to a beauty salon somewhere, or do a hairbrush to bring other elements that make a checkup something fun. You can go to somewhere where there's a show and people get together in a happy hour, and in the middle of the way, you're going to do a checkup. Otherwise, you're not going to do it because no one wakes up in the morning. I won't talk about male checkup. I talked about my own. So these concepts that I see of new healthcare models have to be implemented. First, to get connected to several verticals in society, and to bring Uber into the equation, for instance, because we know that transportation is the most difficult thing. Well, you can create digital access, but if you do that, people may not have access to the internet to download it. Their data package may be too small. So will the company fund that? Well, he's diabetic. We have to engage them. So we have to open up our minds if we want to get results, because the mindset that created our current problems is not the same mindset that will solve our current problems. We cannot say that there's a shortage of money in healthcare. That's an excuse. People think that they're billionaires. They spend huge amounts. The United States spent $4 trillion in health. Are Americans healthier than Brazilians? Spending too much does not equate to spending rightly. And bringing these concepts of being conscious in what you're spending with, and health is about connecting. There's no use saying that we want a connected health and you don't get connected to logistics. Well, patients have to come to us. So let's use pharmacies that are everywhere. Pharmacies have a Wi-Fi connection. You can do corporate management through those touch points. So I think that we have to bring more discussions like this to the table. And maybe we can have one discussion like this every 2 months, and sit together and think about how to connect all this to come up with a new healthcare model. Because we know that the way we were doing things, we know what that will result in. And I think that you who are coming into this scenario are doing different things. We're now moving towards our final minutes, and I'll leave you free to discuss. We talked about making a checkup fun thing, connecting people, easing transportation. So maybe you want to bring another different element in that regard to the audience, and the audience that that does not know what you're doing. People know what conventional healthcare is, but there is many people that are doing great things below the radar. Well, there's one thing that really connects with what you said. It's a message that's really nice when it comes to rethinking what healthcare means and connecting with the checkup. Like you said, we have this perspective that taking care of your health is, doing a checkup every year. I take good care of myself. It's not like that. It can be a great experience, but at the end of the day, I could have maybe one or two parameters misaligned. You talk to a physician, he'll give you the instructions, and 1 year after, you're going to go back there. And one very nice thing that really sits at the origin of what Vitat is that your health is going to be determined during that period between checkups. A checkup is simply a snapshot where you render accounts and think, well, I'm well or I'm not well. But between two checkups, that's when everything happens. And there's the point when you are or not taking care of your sleep pattern, your nutrition, that you're more or less concerned with physical activity and mental health, the health of your relationships. So when we talk about health, and that comes from this heritage of a system, and let's be fair, the healthcare system solved countless problems in the past. If you think, the system only focuses on diseases, but if we go back in the past, we will see that the causes of death in the past would require a system designed the way it is designed now. But with time, this system triumphed and people started surviving more. And little by little, diseases that were big problems, those diseases now are the result of longevity, which are chronic diseases, the biggest causes of death, cancer, for instance, associated to aging. So if you look at the model, you think, well, and that was one of the biggest things about Vitat. We think, we have to address what happens to individuals between medical appointments, between checkups, which is actually when you determine your health and longevity. How you eat, how you exercise, and it's hard. We talked about engagement. It's much easier to engage somebody if they're in pain than otherwise. The chronic diseases are extremely silent. Some people will spend years and years simply not knowing that they have a diabetes that's totally out of control, or hypertension. So the biggest challenge ahead of us is about rethinking health, and for us to understand that the main factors are changing our habit and engagement and monitoring them. And that, to me, is the biggest challenge. When it comes to retail, what's the power of retail? It is to have this physical contact, this routine, and this follow-up of your customer, and them being there with you when they're consuming a product, whether it is a healthy food or a vitamin, when they go to a nutritionist, to a psychologist. We have to look for ways to engage them in this routine so that they have an impact on their health during these moments, these gaps between checkups. And checkups are, again, extremely important, but they're just a snapshot of the checks and balances of our health. So that's a very nice impact that I wanted to share, because Vitat that's what it's all about. Our goal is to address these issues that will make people healthier in the long run, and also take off the pressure of this system. If it continues like that, it will start seeing more and more bottlenecks. The way it is now, it's much more reactive than preventative. And that's an essential problem. Thank you. Do you want to make any comments? Or I can ask, I have two questions. No, you can ask the questions. I fully agree with Bruno. Well, I just want to add something to what Bruno said. Checkups, isolated. There are publications in the United States. It says that it hasn't improved people's health. And doing a checkup just for the sake of doing checkups, well, that is no good if it's not combined with the change of habits. It's simply is there to make you spend more money. Yeah, in addition to being not nice, right? Yes. And that's one thing. We have so many things going on, so much data that people use for nothing or use very, very little. That was perfect. And there's the checkup providers. I'm in favor of checkups. I do a checkup every year, but it's all about doing a checkup in association with these elements. It has to be integrated, and that takes us back to a connection. Well, there's two questions that we received in the chat. The first one goes to you, Salgado. How to reduce corporate resistance to artificial intelligence and its algorithms, and how can we have traditional physicians incorporate these tools as supporting tools for the decision-making process. Everybody says that physicians are resistant, but physicians, as soon as they go to university, they're trained to study every day. Literally, after periodically, you have to study. And to give you an idea, the amount of medical information in the world doubles every 73 days. So every 73 days are totally outdated. So yes, we are trained to study. We're always innovating, always looking for new operation techniques, new drug techniques, new drugs. We're not resistant to innovation, quite the contrary. The thing is, we don't have an administrative related education or a technology related education, and we become resistant to that type of change because we don't know how to do it. That's the truth. If you don't know how to do it, then you become resistant. Oh, no, that technology, I can't deal with it, so it's no good. So it's important to understand where the resistance of doctors is. We are totally early adopters. We're trained to be early adopters since university. If you don't get updated, you'll be out of the market. So can you tell us how you're dealing with this resistance in corporations and if physicians are really resistant to incorporating technologies? I'll try to be brief. Well, talking about the resistance of physicians, well, that's good because quickly adopting, and of course, you have to be quick. You have to be resistant. And as we say, what happens between the research to the moment you take it to your office, there is some distance, and it should be like that. And technology that's what it is for. We have a lot of technology, a lot of data, but we adopt it. If you go to any big hospital in Brazil, you're going to see the sheer amount of technology that they have. And well, it's good that we're resistant, and that's the way we should be. And one thing that you mentioned is that we don't learn this perspective of the patient's perspective. We don't learn that at medical school. We learn how to solve a clinical problem. As Bruno put it, if somebody shows up at an emergency room, I have to solve it. Or if the patient is bleeding in front of you, you're not going to try to find out what everybody thinks about that, right? That's not how it works. But we can apply that to everything in health. I think resistance can be overcome by understanding and by discussing the gains that are there for everyone. That's another thing. We often build things that worsen the days of healthcare providers. There are physicians that have to open 4 screens to do a medical visit, and you spend so much time with that. Then you ask people not to be resistant. Of course, they're going to be resistant, and we've been working on that, on showing the purpose, showing the whys, and showing the results, because it's a win-win situation for everybody who's in the chain, including healthcare professionals. And the resistance against the adoption of AI, to me, is natural against any new technology or new healthcare model or a new business model. Nubank, for instance, when it was created, if we look at what people think and what people used to think when it was created and what people think now, it changed a lot. Artificial intelligence is yet another tool that if we don't show consistently, starting out small, showing the results and showing where it makes a difference, we're going to bring more and more resistance. What we see frequently is unnecessary use and trying to do something very big before having incremental results. So we have very few operational models in artificial intelligence in health that do something different. The way to overcome resistance is to do what's necessary so that there are results. We can see the results and show them. Oh, you were brilliant in your comments. And that's a buzzword, machine learning, artificial intelligence, right? But okay, what books do you use? Oh, the books, I don't have them yet. Okay, so what are you thinking? I've been saying that a lot. Machine learning, it uses probabilistic data. Machine learning is a medium. You have to predict the future. The gurus from the past do not need machine learning. Looking at deterministic data does not require machine learning. So you see people full of BS when they start using that word, and you see that they're not using the technology. We still have 5 more minutes. They'll let us know. I have a question for you, Pipponzi. Pharmacies showed their worth in the pandemic, guaranteeing access to people who didn't have it. The question is, what about telepharmacists to give support to pharmacies in small towns? Would that be a good solution? That's a great question and a very nice one, because that connects us back to discussions and projects we have. Well, first and foremost, I think that the pandemic really brought about a lot of security for some theses that we had in the beginning. In 2018, we started assuming this perspective of pharmacies as being a point of entry into the system, and the pandemic really showed us this potentiality. And we actually ran over 3 million tests this year, COVID tests at pharmacies. And the role of pharmacists has really changed a lot during the pandemic, and how people are now associating pharmacies with the service and not simply with being a point of sale. That really changed.
The role of sorry, we had a, have you heard? So when we talk about telehealth, pharmacy teleservice, yes, we see this technology as a high potential and outreach technology. But we don't restrict this only to pharmacists. When we talk about Vitat, let's talk about two things. So it's a great connection point that will bring this connection between various health care players. The role of Raya and Dogasil are going to have a pharma teleservice to give greater outreach to the pharmacy service they provide. But likewise, we can connect to where we can have these great technology of telespecialty, so to speak, so that we expand the outreach of these professionals with the public we serve and use the solutions. This vision is very consolidated today within Vitat. Today we do some integration work with that, and certainly pharmaceutical teleservices will be one of the first that we're going to provide, considering the very origin of Vitat within the system and considering health and prevention. Thank you very much for the question. Wonderful. I want to ask you a question. You who always, Guilherme is a long-lasting executive ahead of his time. So you have corporate health, literally, with technological basis. So you have a marketplace, you see retail pharmacy moving into health service. How do you see this new digital operator, this new Alice model that has been trading paths for a new model of digital operator connecting with these universes that we can, at least in this panel here, I create a connected health system between three players. How do you see that? Where is the role of the operator within the other models? So, we are not an operator. When Alice is a health manager, it will take a while for the penny to drop. Well, many decades we've been talking about that, health service. So we are very within this concept, in this box, thinking within the box. Yes, open the boxes for me. Precisely. So we have deconstruct the box. It exists because somebody put the box there one day. Well, somebody has done it. Okay, cool. So we're making another box. So the other box is a health manager. In it, it has a product. One of the products that are part of the service is a healthcare insurance that is there for when you have a health issue, when you have to be followed up because of a chronic disease, etc. But you have other layers that are the layers of promotion of health, especially in healthcare teams. In addition to that, Alice will not provide a solution to all. What Bruno is saying is that possibly the person may need a given type of service that is not Alice's service. It is what we've launched now, version of Alice's app for people that not buy the whole product, so that people can try it out, and they may buy services that we sell or access to other free services. And for example, visits, appointments, so you can upload your tests on the app, and thinking about the platform head, it can access other services for that Bruno is providing when they need to access drugs, and we can plug that into the context of their journey, Alice. So we, as the health manager of the person, we're going to provide part of the services, and we're going to integrate other parts of the services with external partners, as long as this resolves the journey of the person. And what Bruno is saying about Vitat, part of their activities may resolve part of the journey of the patient once they've gone through an appointment, etc. So, or else, I don't know. A typical journey is nutrition. The person goes to a nutritionist, has an appointment, the nutritionist provides a diet or suggests a food change, and they say, okay, now I have to go to that place find on the web and find all these things that people have prescribed to me. So I'm getting as a gift the list, but I'm getting as a gift the work of looking for all of that and buying that and making it being delivered to my place. How can we integrate the list from the nutrition? So you click on it and everything gets to your place, and it's going to be on your monthly invoice of what you pay to Alice. You have this additional cost. So how do we integrate everything? So I think this is a huge opportunity. The point that I just wanted to bring up that is very important is that what we cannot measure, we cannot manage. So what's very important about data, I think a great lost link in health is basic. So, for example, a person has invested in a process of health promotion, treatment of a disease, and they have an outcome. And what I'm going to talk about is value-based medicine, tele-based or value-based care. How do you measure this result? How do you measure the effort based on the result? And how do we open this up? How can this be totally transparent to the health system? How do we know a hospital A in a procedure X is better than hospital B in the same X procedure? How do we know? How can we tell? How can we give more transparency? All of this is more on data, providing transparency to data. So to give you an example here, so in Alice, everybody that joins, we measure several things, all quality of life, PhD, so the indicators of anxiety and depression. So to have some metrics on everyone after 3 months, we reevaluate, person asks again if they're in the program. So we have some basic, right? So they have to answer automatically. So today we can tell 76% of people, they improve their miracle after 3 months of Alice, 93% of people that have depression improve their indicator of depression. Same thing for anxiety, 80% improvement. Well, we measure PHK9. So how can we actually on the same journey measure the outcome? What I'm talking about is measuring outcome on resources that have been invested in the process of improving the health of the person. And then things start tying, and we start measuring in different ways of making decisions that are more cost efficient for those systems. So I think this is super important to me. This is the lost link in the health sector, in addition to the patient-centered journey, measuring outcomes, efforts, results on efforts, and delivery, right? Everything you buy and the rest of the economy sectors, you measure deliveries. You buy something, you receive something, and you measure the delivery, the result of the service you bought. And in health, it's still a bit cloudy. Okay, thank you very much. I've been told, yes, well, it's been delightful to spend this morning with you. Let's do it again. You're fantastic. Congratulations for your 3 initiatives. I'm super fan. 3778 is my neighbor, and this I always kind of tweaked a bit to see what they were doing. I've had the opportunity of talking to Kia other times in the environment in Bruno. For a long time, we've discussed things, discussing these marketplace models, how to be present in the sector. Thank you very much for your contribution. The kids, well, we don't know what happened to Dr. Shap. I do hope I have been up to brilliant Dr. Shap. And thank you very much and great gratitude from the bottom of my heart.